Uh, Good morning. Today's topic is renal artery stenting through transradial approach. Stenting for addressing the renal artery obstruction is a well-known and established modality of treatment in the interventional field, and it has been practiced from femoral root since long. The results are good, the acute results are good, and long-term results are also excellent. We will discuss transradial approach for addressing the renal artery blocks. There have been anecdotal small studies and case reports on it, and we being one of the very busy transradial center for coronaries and peripheral interventions, we have developed this technique, and as of now we are already done with more than 200 renal artery stentings through radial approach. When you address renal blocks through transradial, first thing you need to look into is the height of the patient. If the patient is very tall or even medium size with above 5 feet 8 inch, then you should prefer the left radial. If patient is short stature, then right radial is also alright. Why left radial for tall patients? Because if you use left radial, you are eliminating the length of the arch of aorta, that is about 10 to 15 centimeters, and if you puncture high in the left radial, then another 10 centimeter length you can save. So by using regular hardware which is available in the field, you can address renal arteries without much of the problem. You don't need long catheters and long sharp balloons and long sharp stents. That is the reason. Why radial? We have found certain advantages of this approach for renal artery stenting, because if you see the origin of renal artery from aorta, there may be transverse origin. For transverse origin of renal artery, whether you are using the femoral or radial, it is the same. But if there is an origin like this downsloping, which is not uncommon, then working through the femoral, cannulation as well as the guiding catheter backup can be a problem. While working through the radial, you are coming from the above, you can cannulate and the catheter can be adjusted coaxially, and you can get an excellent guiding catheter backup support. Using the regular 6 French sheaths and regular guiding catheter, that is 6 French, any guide, right Judkins or sometimes the multi-purpose, depending on the situation, you can cannulate the renal arteries, and then you can always apply the standard technique, wiring the renal block, pre-dilatation if need arises, or even the direct stenting using the same. And most of the stents being used are between 5 and 7 millimeter diameter, and you can easily use them through 6 French guide without much of the problem. Another advantage which I see for using the radial approach for renal stenting is many of the patients have very severe hypertension and malignant hypertension. You may increase the chances of groin hematoma working through the femoral, while if you are approaching the renal blocks through the radial approach, you can eliminate this hematoma and bleeding related issues. So I think these are few tips which you need to remember. Thanks.